I'm Dr. Anthony Cave, a Stanford and Harvard-trained anesthesiologist, here to talk about the topic that everyone is talking about today around ketamine. Not from Matthew Perry, who tragically passed away 2 years ago from ketamine, but Elon Musk, all over the news in his relationship with this drug while he's one of the top advisors to the President of the United States of America. So should this person with such high security clearance be using drugs like ketamine? Is there a role for ketamine? Being a doctor who has seen over 1,000 patients in IV ketamine sessions, I wanted to share the reality, if you will, give you break the distortion field around this drug that has gotten a lot of sensationalism in the media. His drug problem much worse than people think. How about the Rolling Stones article here? He doesn't pee right. Elon Musk and his bladder. We're going to talk about it in a second. This video in particular caught my attention on YouTube, questioning whether Elon Musk was on something at this event at the White House. So I want to answer your top ketamine questions in this live session today. And I want to really be clear that the media sensationalism around this powerful medication could potentially be worsening stigma on a topic that's already so heavily burdened with stigma, whether we're talking about acute suicidality or treatment-resistant depression or PTSD. Certainly, we don't want to make this worse for folks who are struggling because of headlines like how Elon Musk pees. I'm sure we would all agree with that. Now I want to go through a couple of these points because this gentleman had a tremendously high security clearance and charges so much of our taxpayer dollars here in the United States. So to be very clear, ketamine has been FDA approved for anesthesia for over 50 years in the United States. In 2019, it was FDA approved in the intranasal S-ketamine form for treatment-resistant depression. So ketamine, first and foremost, is a medication used in humans, and yes, it's used in veterinary applications as well, for horses, for dogs, for cats, like many other medications that are first developed for humans and then transitioned to animals. That's a normal process. Nothing unique to ketamine, certainly. It comes in many different forms. The sublingual and the IV form are often used off-label for treatment-resistant depression and other mental health conditions. The intranasal form, Spravato, is FDA approved. So that's only one form of ketamine. That's not the one that I suspect Elon Musk is using, nor was it the one that Matthew Perry was found with at the time of his passing. To be clear, ketamine should always be used with medical supervision, not at home, not like a Michael Jackson situation. Could it affect the security clearance of someone who is using ketamine with medical supervision? Let me ask you this question to really clear the waters here. Can someone with a security clearance have surgery? Because if you're having surgery, you might be getting ketamine as part of your surgery. You might be getting propofol. You might be getting nitrous oxide or laughing gas. Should that preclude someone from having a security clearance? I think we'd all agree no, provided they're not under the influence of their anesthesia during their work, when they're making big decisions. When I have a patient who's getting surgery or receiving ketamine, I tell them not to drive in the 24 hours or however long that medication is supposed to last in their system, not to operate heavy machinery, make big financial decisions. And if we follow those rules, people can carry out their daily lives. That alone is not a big concern for me. I think that one has been sensationalized. When we're using ketamine, because there's always a risk of addiction with this medication, like with many other medications, benzodiazepines, certain antidepressants, gabapentin, it can be so hard to come off of these medications to a point where we develop a heavy tolerance. Ketamine is no different, however rare it is, which we'll talk about in a minute. But the underlying goal here, to minimize any side effects, in addition to addiction, is to use the fewest number of treatments for the greatest, longest lasting benefit. Please let me know in the comments if you are with me on this. If you ever feel like you've been in a situation where you're just taking the same medication day in, day out, like a Band-Aid, and the second you stop, you feel worse. That's not the medicine that I try to enable my patients with, to be clear. Does it help with pain? Yes, Elaine. It helps both with emotional pain and physical pain. We can talk about this in just a bit. And Gore Fluffy Gore Guts is right. So many folks under the influence are driving, not just alcohol. Here in San Francisco, we have a huge problem with folks with cannabis. cannabis driving. So of course, whether you have a security clearance or not, we do not want folks to be doing these types of activities under the influence of any drug. Is it addictive specifically though? I got a study here just to demonstrate how rare it really is for this drug, even though it sounds so scary. I don't know if you can read what I put up here, but the risk is certainly there. It's just vanishingly rare when used properly with the ethos that I'm sharing with you. I want to talk about Elon Musk's bladder as well because of the risk of bladder injury. Don't worry, we're going to talk about whether it makes you weird or whether it makes you smarter in a minute as well. But I want to first address the bladder that Rolling Stones really wanted to put front and center on their website. Ketamine-induced cystitis is a real condition. Cystitis refers to the bladder. Cystitis means inflammation of the bladder. For reasons we don't fully understand, ketamine can cause either hypersensitized nerves around the bladder or cause outright inflammation. It is pretty much only seen in drug abusers, and there's a lot of reports from East Asia where ketamine abuse recreationally is much more common seemingly than in the United States. It can be irreversible, meaning if you mess up your bladder and it hurts to pee or you can't pee properly or there's blood in your urine, in some severe cases, it might not be fully reversible. Fortunately, it appears that it usually is reversible, meaning it can come back to normal. There is one case report, I got it here for you, of a young woman who was on ketamine seemingly 2 to 3 times a week for 18 months or so when they started developing urinary symptoms. They stopped taking their sublingual ketamine and it went away, fortunately. So that's one case report that I'm aware of in the literature. This came out last year, 2024. So the risk is absolutely there. Maybe Elon Musk was using a heck of a lot more for a lot longer. So what did we say earlier? The fewest treatment number for the greatest benefit. That's good medicine. It's what you deserve if you or someone you know who has been struggling with depression or PTSD is looking for any type of treatment, an SSRI, an atypical antidepressant, or ketamine in any form. Does ketamine make you weirder? Is this guy here, look at this. I don't know what he's doing with his finger, but does ketamine make you weird? In the acute, during the period that you're under the influence of it, yeah, it can make you say things that you might not ordinarily say, just like you would under anesthesia with laughing gas or with other types of medications. Does it make you permanently weird is the question that patients often ask me. Am I going to be forever changed and be a little off my rocker? Surprisingly, no. And more importantly, let me ask you, can untreated depression for months or years make you, I don't want to say weird, but can it make you different? Can untreated PTSD or chronic pain make you weird? I mean, once again, is it making you weird or is it making you someone other than your true self? I think most of us here who have either ourselves struggled or seen someone else struggle would say absolutely that an undertreated mental health condition or physical health condition can certainly change who you are. So while there's no real good evidence for ketamine used in a medically supervised fashion causing that, certainly an undertreated condition that we might be using ketamine for could cause that. The other question here, can it make you smarter? I mean, this drug use that's all over the news by Elon Musk was reportedly, and I shared this in a previous video, Elon said that his investors should want him to continue taking ketamine because seemingly he's having a better performance managing his companies, etc. from it. I'm not his doctor. I didn't hear him tell it to me, but there are a lot of questions about do psychedelics, does, as you can see here, the ecstasy, the mushrooms, etc., can they improve our intelligence or our creativity? A question patients ask me all the time. In short, ketamine does have some pro-cognitive effects, meaning that they can perhaps enhance some elements of our cognition. And what's more interesting is that it appears to be independent of the antidepressant effect, because if maybe you know from personal experience or anyone else that you've ever seen a loved one, your memory can take a hit with depression. In fact, there's a permanent IQ hit, as seen in some studies, on our memory. Permanent IQ hit overall in our seemingly intelligence measures when we have an episode of major depression. So independent of ketamine helping that underlying cause in some cases, there appear to be some pro-cognitive effects, but there not very well studied, and I certainly never would use this drug or provide this medication to a patient just for that reason alone. So is that why Elon Musk was doing it? He certainly insisted, I don't have all the news reports here for you, but he insisted he was doing it with a prescription legally. Though, as you probably also know, ecstasy isn't legal. So there are a couple of holes in the story. I'm not there specifically with them to know what's going on, but I do want to raise awareness that there's a lot for us to learn for these modalities that might one day be approved by the FDA so more patients could potentially experience some of the benefits with medical supervision. With that said, I really want to answer your questions. So thank you for everyone who's been asking questions here. I'm going to try to get through as many as I can. And remember that if you're learning something new, please share what you've learned with your loved ones. You can hit that like button to support me doing this for you more often. And remember, you can always visit my clinic's website at claris-health.com. The link is always in the description below. But Elaine had asked earlier about chronic pain. Can physical pain be improved with ketamine? Well, let's remember that we want to use the right form and use the fewest number of treatments. And if we follow that rule, in many cases, yes. I'll tell you what most folks won't tell you. Pain has two parts to this. There is the potential for tissue injury. It is neither necessary nor sufficient for the perception of pain, however, because you also have the nerves that transmit that pain signal throughout your body up to your brainstem, where it reaches your brain where it can be perceived. You can have problems in either of those two categories. Ketamine cannot necessarily fix the former or the first category of tissue destruction. It has some anti-inflammatory effects which might help a little bit, but we believe its anti-pain effects involve the transmission of pain, meaning if you have dysregulated nerve transmission for any number of reasons, chronic regional pain syndrome. In some studies, fibromyalgia appears receptive, maybe trigeminal neuralgia, migraines, the list goes on. Can neuropathic pain patterns be improved with ketamine? In short, often yes, not always. Sometimes what you won't hear about is that topical ketamine can provide benefit. So if we want to avoid some of the systemic or the body-wide effects, there is something very interesting there that with the right doctor, you might be able to find some improvement to pain in a way that does not require ongoing use. For example, in my clinic, I might do a booster session for someone once every 8 weeks, once every 4 weeks or so for their pain because of the long-term pain relief that ketamine in some patients can provide, not all patients. Alexandra, I'm sure K is totally banned in Australia. I doubt it's banned because ketamine is on the WHO list of essential medications. So I don't think it's banned in Australia, but I'd want to know how it could be used and whether off-label use is permitted. Judy, thank you for being a member of the channel. It helps me do this for you more often, and it helps me see your questions, by the way. Brain pain pathways are my primary issue. Doing cognitive pain relief classes currently. Well, Judy, it's that way for everyone because you cannot escape the fact that you need to have cognition to perceive pain. So anything in your cognition can influence how pain is perceived. And I certainly hope that you find benefit with your pain relief, your cognitive pain relief classes. Everyone likely stands to benefit. From my own personal experience with chronic pain, I know there is a huge component to it. Hey, you're very, very welcome. So many questions. Stay frosty, Dana. I don't know what you mean by that. Mara says, my ketamine treatments are spaced between my surgeries for a total of 4 treatments a year. It works wonderfully. Bingo, Mara, you crushed it. That's exactly what we're talking about. The fewest treatments for the greatest benefit. Many folks prefer to use that model instead of like daily oral medication use. There's a chance for having fewer side effects that way and better effects. Awesome. I wouldn't wish neuropathy on my worst enemy. Sinfully wicked. Yes, I agree. Neuropathic pain can be very, very challenging. I'm curious about what others here have experienced. And hey, Heidi, thank you so much for sending good, positive vibes and prayers to everyone here today. So many good questions here. Topical cannabis, Cyborg Mama. There are many ways of using topical cannabis, and many folks can have benefit with improved healing from wounds topically, and sure, that can help pain be relieved faster as well. Very, very good point. Angela, you were the one who informed me about ketamine. I sought it out with my psychologist. And Angela, I'm curious how it went out, how it played out for you. Wonderful. Does ketamine react with blood thinners? Nancy, fortunately, it does not. Do you think insurance will ever pay for K treatment? Well, it does pay for S-ketamine nasal spray in the form of Spravato. It's not as effective as IV ketamine or intramuscular ketamine, seemingly. There aren't very many studies that put them side by side, but IV seems to be the most effective. Will it ever be approved is unclear to me. I think there's a good chance that it's going to happen. Would ketamine help occipital migraines due to failed fusions? I've had some folks who report, well, there's no question in the literature, ketamine can help migraines, especially in emergency room departments. Your specific occipital migraine, it would have to be an empirical question because there's no one modality that works for everyone with migraines, certainly, because there's so many different flavors to migraines and how migraines manifest. So I think it's worth exploring that. Hey, hearts right back to you, Gabrielle. Heidi, who do you see try ketamine by sublingual or nose? I've seen folks from all ends of the spectrum, young and old, different races, different socioeconomic statuses. There's no right or wrong answer as long as it is medically supervised with someone who has expertise with ketamine in that specific form. I don't like to see people who are getting a form of ketamine from a provider who really shouldn't be dispensing or administering the medication. It happens too often, unfortunately. Cyborg, you are very welcome. Hey, Kristen, thank you for being a member. Do I usually use ketamine for surgery? It's not the most common medication I use, but it's quite common for sedation cases that I'll use it. Sinfully Wicked, you're very welcome. Caitlin, I wish you could be my doctor. You give such thorough and compassionate answers. Well, you're very welcome. Thank you for the kind comments. I think he would raise safety concerns and be a hazard. Let's see. Is it easy to stop ketamine after 18 months sublingual? Connie, that's a very good question. It depends on many factors. How often has one been using the ketamine sublingual? Is it like every other day or is it once a month? What is that person's relationship with the medication in terms of how it's helping them feel better from the condition they're trying to find relief from? I've certainly seen people stop it. My first question is, why does one want to stop it? And the second question is to see how long has one been able to go off without it, and have there been any psychological ramifications to it? Hey, thank you so much, Heidi, for reminding everyone to join our community to help me do this more often for them. I'm so happy to... Okay, Roberta, I'm grateful to hear that you are perhaps finding alternative ways to ensure your health, hopefully with proper medical supervision along the way. Doctor, referral to a ketamine clinic, you don't necessarily need a referral. If you're using Spravato, you might need a referral from a mental health specialist. Depends on your specific insurance plan. How are the benefits of ketamine versus EMDR? That's a very good question. I often will describe ketamine as a rocket ship compared to EMDR, which is kind of like a car on the highway. EMDR is such a powerful technique. It's very accessible for folks with PTSD. Ketamine for folks with PTSD has a lot of evidence behind its use, not as much as treatment-resistant depression, but I'll just give you a story of how a patient told me that you never forget your trauma, but after ketamine, he told me it's like I can walk by the bookshelf, or the bookcase is the shelf, and I see it like a book on the shelf. It doesn't sabotage my central nervous system. I know it's there. Another person told me it's like a painting on the wall, that they can walk by it and they can observe it without having it take over their body. EMDR can do similar things. There's just not a lot of good studies to compare these things side by side. I'm not familiar with an EMDR pain protocol per se, though. Gina, always a VIP. Thank you for the kind comments. Carolyn joined late. You can watch the replay, so you're good. I'm a recovering heroin IV addict and on methadone maintenance. I've heard of people using ketamine to get off and not have withdrawal symptoms. Is this true? Carolyn, yes, it's true that the low doses of ketamine can help reduce opioid withdrawal symptoms. I personally will use NAD if I can instead of ketamine for that, but there's some cases where ketamine is very helpful. One has to make sure that you're getting not too high of a dose, not too low of a dose, but there is certainly evidence that some of it's pre-peer reviewed, but absolutely anecdotally I've seen this work. What are alternatives for patients who are allergic to ketamine? Porter, for what indications are you asking for alternatives? For depression, for anesthesia, for pain? The answer would depend on the indication. Very good question, though. My only other social media platform is my chart, says CyberDoc. That's, I don't want to make fun of the situation here. It's very funny, though, I'm going to be honest. You put an emoji, so I'm going to laugh with you on that one. What makes ketamine so powerful? Caitlin, it's a particularly dirty molecule. It attaches on many different receptors throughout your body and provides a level of glutamate receptor modulation that appears to augment this neuroplasticity, which is not common in most of our prescription medications to date. It is this footprint that ketamine leaves that makes it potentially powerful, but never, this is not to say that ketamine is a panacea or a unicorn rainbow thing that's going to work for everyone. It's not snake oil. But in the right person at the right time with the right doctor's supervision, it can be surprisingly effective. Isn't that what killed Michael Jackson? No, that was propofol. Very good question. Morphine makes me very sick. Dilaudid makes me super happy. You're right how just a couple of changes on a molecule can completely change the experience that one has with that medication. You're all very welcome. And Porter from anesthesia, if someone has an allergic reaction to ketamine for anesthesia, we will use propofol or anesthesia gas or etomidate or nitrous oxide. Many other medications, fortunately. Let's end with Lisa's question. I don't know if ketamine is something that is offered in the UK as pain medication. The only time I've had it is when I was put into an induced coma for seizures. It was the first time I had it. So I don't know how prevalent ketamine use is in the UK, but I can certainly say that I'm sure it's used in the operating room, independent of its use for seizures. It's curious that ketamine can lower the seizure threshold, but also can be used to abort seizures in some cases. SN, I think it's kind of a funny question, no offense or anything, but no, the answer is no. Carrie, I guess we'll end with you actually. CRPS, ketamine is one of the few treatment modalities we have for complex regional pain syndrome, formerly called reflex sympathetic dystrophy, especially if it's in a truncal area or a place where we cannot provide a nerve block to calm the sympathetic mediation. I keep saying last question, but this is such a good one. What about PMS? Ketamine has activity on the estrogen receptor alpha, ER1. So it actually has, in some folks, it's not well studied at all, but anecdotally helps with luteal phase symptoms, PMS, PMDD. I believe, but who knows, through an estrogen receptor agonism. More interestingly, it has potentially bone protective effects through, we believe, maybe a similar mechanism of it increasing biomarkers of osteoblast activity or bone building activity. You know that estrogen is vital for bone health. And because ketamine seems to have estrogen-like activity on some receptors, perhaps that is why we observe some of the biomarkers changing with ketamine in these folks. So if I have a woman who has PMS, PMDD, and they're at risk for bone loss because of maybe they've had their ovaries removed earlier, or they're in premature menopause, or they have genetic predispositions because of a vitamin D receptor mutation, or any other number of reasons for osteopenia, gosh, it would make me really want to consider the totality of benefits for that individual. A great discussion here. Remember that you have more power over your health than you've ever been told. I just want to remind you to not let media sensationalism overly stigmatize such a powerful, potentially powerful treatment. It's not a panacea, but for a condition that can have really severe effects on our body, we really don't want to let Elon Musk's bladder sway our decision for what might be right for our mind and body or that of our loved ones.